So welcome everyone. We're excited that you're here. Our presenters today are Zoe Rivers and Brittany Kowalski. First, we have Zoe. She is a certified exercise physiologist and health coach, passionate about behavior change and redefining how we measure health and well-being. Her early career was focused on working with college and professional athletes on and off the field. Being surrounded by high-performance individuals sparked an interest in sports psychology and behavioral science that she pursued through leading independent research studies and developing assessments that measure the impact of health and well-being on healthy habits. Over the past decade, she has been fortunate to work with hundreds of coaching clients and present as a guest speaker to private companies and organizations like the Girl Scouts of Greater Atlanta. Her goal is to continue to find innovative solutions to support individuals in living and sustaining healthier lives. Thank you, Zoe. We're happy to have you with us today. We also have Brittany Kowalski with us. She was one of the very first nationally board certified health and wellness coaches in the country. While sports medicine was her first passion, she became drawn to preventative approaches with her patients and threw herself into learning new ways to help motivate people to manage and prevent chronic diseases. Her diverse experiences as a health promotion specialist include diabetes lifestyle coaching, mental health initiatives, and even laughter therapy programs, have allowed her to walk beside and help guide people on their wellness journeys. Over her career, she has been sought out as an expert in the field of health coaching, including speaking opportunities for the American Diabetes Association, the Medical Affairs Professionals Global Conference, and American College of Preventive Medicine. In addition to her work as a clinician, she has also helped to initiate health coaching programs in various large-scale hospitals across the nation with focuses on cardiometabolic, pulmonary, bariatric, and physical therapy. Thank you, Brittany, for being with us today. And with that, I will let you all take it away.
Awesome. Thank you so much, Suzanne, for that warm introduction. And welcome everyone today. So today we have an exciting program planned for you. We want to share with you our experience and our expertise in building a virtual environment that allows you to maximize health and wellness outcomes for your populations, and that allow you to build a personalized experience and even allow you to scale your services and, of course, your impact. So before we dive fully into this, we're quickly going to take just a few steps back and just revisit how we got to where we currently are in the first place with digital health. And of course, looking at the challenges that we face today and how they evolved over time as well. And that way we can just ground ourselves in the topic and for the remainder of this presentation. So to kind of look at the background of digital health, the early version of what we know today as digital health started back in the 70s when health providers used telemedicine to extend services and care that focused on disease management and improving the diagnosis and the treatment of diseases. So this method has really become one of the tried and true methods over the last 50 years. And as you can see here, there really wasn't much development for the following 3 decades after telemedicine was implemented. So then, of course, with the boom of the internet came e-health. And as you all remember, the early feel of the internet was more so of a knowledge base. And so e-health really focused on health promotion and on health education. And that really took it just from disease management and treating to starting to educate our populations. So then just a few years later, in 2010s, we can see how things are slowly evolving much quicker. Health services became even more accessible with the birth of smartphones, of course. So allowing people to have access to certain resources at any time. And that's where we really saw the shift towards supporting behavior change rather than just promoting it. And then lastly, of course, we arrived in 2015, and that's when we started seeing that's when we saw the birth of digital health. And the digital health is really just this huge umbrella that encompasses telemedicine, e-health, m-health. It also includes all of the wearable technology that we have. I'm pretty sure if everybody kind of just looks at their wrist right now, we're all part of this entire digital health system. The AI and the technology that come along with it. And of course, also certain features like real-time data collection. All of that is part of digital health as we know it today. So then there are a few more relevant trends that I quickly want to touch on and that I want to point out before we start moving deeper into this conversation. So prior to COVID, we started seeing the birth of healthcare consumers within our space through this gamification of health interventions and game-based learning. And most commonly, this was spread through employee wellness programs or fitness facilities. So we saw the heavily, like the incentivized version of all of this, where people got to engage with healthcare in a new way and where this consumerism really was born. So we started seeing more and more use of e-health, m-health, wearable devices, and a new ecosystem, so to say, was born, really connecting all aspects of digital health. And then we experienced life, of course, during the pandemic. So prior to the pandemic, there was still this hesitancy from providers and from the population, especially in traditional healthcare and wellness settings, to really maximize digital health the way that we're starting to see it now. Due to COVID and due to living through this pandemic, we really saw this shift in our culture where it went from a nice to have to a need to have now. And people are more and more dependent, not just is it a necessity, but people really have become dependent on different channels of care in order to have access to the care that they need. There are lots of data out there that support that. This data is from September, where the J.D. Power surveyed consumers of telehealth, and although forms of and although forms of telemedicine and telehealth have been around for 50 years, the biggest growth really came in the past 2 years. So as you can see, it almost doubled from 2019 to now, September 2022, where 37 people preferred the use of telehealth to compare to 67% today. And as you can see, majority of people prefer the use of telehealth for prescription refills, reviewing their medication options, discussing test results and mental health visits. And of course, the pandemic was the main driver of all of this, but the other important factor was the widespread accessibility of mobile devices, which brings us to our first poll. If I could ask that to be launched. Our first poll is, how many adults use text messages these days? We're going to give everybody just a few minutes to provide your insight and see what it is that you all know. Maybe just a couple more seconds. All right. Oh, do you have it? All right, majority, 59% of everyone says 87% of adults use text messages, when in fact, we have 97% of adults that use text messages, 93% of adults that use the internet, and then 85% of adults that have a smartphone, which means they have access to the internet pretty much anytime, anywhere. So as you can see, this is a huge opportunity for all of us to have an impact on our populations and to really maximize the engagement opportunities that we have with them and really build or have real results. And of course, all of this kind of sounds utopian now. Everything is, growing, getting better, but of course, this comes with its challenges. Excuse me. So as digital health continued to evolve, there were challenges that continue to evolve with it that healthcare and wellness providers are tasked with resolving. I'm sure that if you have offered any kind of digital services or any kind of virtual services, that you have encountered some of these challenges, if not at least one of them. So these challenges are all frictions that truly prevent us from engaging with our populations efficiently and ultimately prevent us from having the impact that we want to and need to have on our populations. As experienced as all of you are in our audience today, none of these challenges should really be groundbreaking or any kind of revelation to you today. And we're not going to comb through one by one. to solve them today. Instead, we're going to create a different kind of perspective and framework for you to take on as you resolve some of this friction for your health and wellness practices. And as mentioned previously, this new kind of perspective that we're looking at is the perspective of engaging with healthcare consumers. We now live in a world, where digital health is being consumed by our participants and by our populations. And some of this we can really see in just the trend of the health spending. So in 1970, the health spending was at 74 billion. 30 years later, by 2000, we were at 1.4 trillion. And then 20 years later, in 2020, we were at 4.1 trillion. So we went from 74 billion in 1970 to 4.1 trillion in 2020. And part of this growth, of course, came because we have non-traditional competitors who have truly mastered consumerism, who are now in our space. So we have the Apples, the Amazons, CVSs, and all of these people who are truly experts in engaging with our populations, who have mastered providing personal services and scaling their content, and especially having entertaining content. However, at the end of the day, we have to find a way to kind of get through the noise and still engage with our populations and have an impact on them. So how are we going to do this? I'm so glad you all asked, and we're all on the same page about this. We're going to take you through a two-step process that will position you in a way to truly understand what your population needs and how to provide it for them. So Brittany is going to take us through the first step.
Thank you, Miss Zoe. So from Zoe, we understand what some of the challenges are that are out there, and we're presented now with opportunity. We have the opportunity, or rather, I should say, the need to better understand our populations. 39% of people really desire a deeper understanding, a deeper personalization to them. And we can accomplish this by looking at three different constructs. One being the readiness to change, two being social determinants of health, and three, communication preferences. So first, let's hop into readiness for change. So the trans-theoretical model, aka stages of change model. I know probably the majority of you here on the webinar, this is not new to you, but let's just take a brief overview because I don't want to make assumptions. It was developed by Prochaska and DiClemente in the late 70s, and it focuses on the decision-making of someone, and it's a model of intentional change. The stages of change operate on the assumption that people do not change behaviors quickly or decisively. Rather, change in behavior, especially habits, it occurs continuously through a cyclical process. If we push people to make habit changes, it can actually have negative effects. For example, less than 10% of smokers are actually prepared to take action on more than one risk behavior. So treating them as if they're ready, it can even be perceived as disrespectful, right? They don't feel heard. In contrast to action-oriented paradigms, which promote immediate action among all participants, the stages of change recommend the tailoring of strategies to an individual's intention and readiness to change. So in essence, you want to tailor things such as messaging based on the stage that your individuals or people in your population are in. And there's actually a very simple technique. So moving on, we get to talk about readiness rulers. You could do this through one simple question. On a scale of 1 to 10, 10 being the most ready, how ready are you to make blank, fill in the blank, change? And you can exchange ready for other things like confidence or committed. So how confident are you or how committed are you? And actually, there's a magic golden number that if people pick this or higher, there's a large chance that they truly will reach that behavioral goal. Otherwise, if it's lower than that golden number, it's time to rework that goal or that approach. So I'd love to hear from you all. What is that magic number? What's the golden number? We're going to launch a poll here. So you can input here if 10 is the most ready, the most confident, the most committed, what's the golden number? Keep on voting. I see some happening in the chat too, so I have an idea of where we're going to be in this poll. But let's see what we all have to say. All right. So 55% of us said 7 is the golden magic number, and that's correct. Behavioral science has shown that if people say that it's a 7 or higher, they're most likely going to reach that goal, or most likely very much ready and in an action phase. And what's also really nice is one of my favorite techniques is asking, tell me what makes it a 7 versus a 5, or tell me what makes it a 5 versus a 7, right? And so either way that you pivot it, it can help them think about what makes them confident or what can help make them more confident. So there's a lot of different techniques that you can use in your messaging. So moving on, first we know now what stage somebody is in, and that's great. But what about the now what? What do you do with that information? And so you can tailor digital messaging and programs to their stage by using what's called the principles of progress. These are ways to help hold someone's hand to move from one stage of readiness to the next. And I'll expand quickly on a couple here. So let's take first an example of consciousness raising that's helping raise the awareness of themselves, their problems, or rather, I like to say more positively, their opportunities and potential solutions. So if somebody is just in pre-contemplation, edging on contemplation, doing something like counter conditioning, which I'll also get into, would not be appropriate whatsoever. Rather, just giving them little pieces of information to get their wheels turning is spot on, way more appropriate. But another quick tip to help get their buy-in when giving information is to ask permission first. Something like, would it be okay if we shared some information on healthy ways to dine out? That helps, that helps show respect. And actually, it gets more buy-in where someone is more likely now to read that information. Let's do a second example, counter conditioning. We really can't unlearn a well-established habit. The unhealthy habit is already hardwired in our brains along very well-worn neural pathways. However, our efforts at establishing new healthier habits can inhibit or block old habits. So over time, these become more powerful substitutes for these old neural pathways. So we have that opportunity to help our people understand more about this neural wiring too. And that can help them foster and encourage self-compassion within themselves when it comes to taking on behavioral changes. So that's just one technique in understanding your population's readiness to change using a ruler. Let's look at another thing that we can look at. Social determinants of health, aka SDOH. Very, very common hot topic, rightfully so. It is here to stay, thank goodness. So these are non-medical factors that influence health outcomes. They're the conditions in which people are born, grow, work, live, and age, and the wider set of forces and systems shaping the conditions of daily life. They include, as listed here, transportation, discrimination, income, polluted air and water, poverty, language, literacy skills, and access to technology. And so it's this concept of meeting people where they are. It actually requires a special kind of humility to admit that even those such as ourselves, dedicated to public health and health disparities, may also be part of the systems that possibly pose barriers to community members. But in the context here, for this purpose of a digital environment, we want to look at the components of our programs. Are we requiring people to print things out? Do they have desktops? Do they have laptops? Do they have second screens? I mean, gosh, all of us who may be working from home now, second screen is a godsend. How does the font size display on a mobile device if they're looking at a mobile device? How are we getting signatures from people virtually? Are we requiring them to download multiple apps? A lot of different things here that we need to consider when we're serving a population digitally. How about, are we incentivizing people with what really speaks to them? For example, a program offers a free gym membership, but what if the individual has never worked out in a gym before and is incredibly scared and embarrassed to go? It's not going to be a very motivating incentive to the program then. Are we also providing wellness programs or challenge opportunities where people feel safe? For example, I know a lot of programs do walking challenges, but I've had it where people tell me they do not feel safe walking in their neighborhood. And yes, you can work on other ways to overcome those barriers, walking around the mall, etc. But are you truly meeting people where they are? We want to ensure that we're providing relevant topics and also having diversity in the topics and offerings. So we've covered now the second bucket in mind for when it comes to understanding your population. Moving on to the third is the communication preferences. What's kind of scary is 57% of consumers think retailers or financial services do a better job at providing personalized omnichannel experiences than healthcare. We have the chance to step it up. People want more touch points from you now. In fact, 44% of people expect more touch points digitally from you now, especially now that 85% of people keep their phone at arm's reach at all times. I'm guilty. It's right here. So what's important when it comes to communication? Quick is important. 90% of people rate an immediate response as important or very important when they have a question. And just so you know, 60% of people define immediate as 10 minutes or less. What about the form of the information? What about self-paced videos as a way to take in educational content? People actually retain 95% of a video's message compared to 10% when reading a text. So videos, much more memorable since people are more likely to recall a story than a list of facts. But let's not neglect the power of a text though. 7 out of 10 people want more text touch points, specifically in between things like appointments. Think appointment reminders, notifications, pre-visit instructions, care instructions. They want that over text. The reason is because I think I saw somebody in the chat say this, it's more convenient, it's quick, it's just easier. And you might be thinking, well, what population? It includes the majority of people over 50 years old. Over 30%, just to give you a few more facts here, because it really helps paint a picture. Over 30% of people would even consider switching providers if it meant that they could get real-time text messaging. And 9 out of 10 people read text they receive within 3 minutes. And the open rate for a text is 98%. Put that in perspective, email is only a 20% open rate. So it makes sense why text response rates are 295% higher than responses from phone calls. I'm sure you're going to go back to the recording here and replay all of those statistics. But I think the key takeaway is there is a lot of power in text messages. So what I've shared is just 3 departmentalized ways of helping to meet your clients where they are, not where you are, not what's convenient for you, what is convenient for them. So now I'll pass it back over to Zoe to talk further about helping build the environment.
Thank you, Brittany. Yes, so Brittany did an amazing job just really helping us wrap our brains around how to even understand the population. We all have a target audience, a target population that we are here to serve. And so it's really important to just paint that picture fully and really understand, the access that they have, just the mind frame that they are regarding to their health, their well-being, their readiness to change, and of course the access that they have and the preferred method of communication. So now that we have this wonderful picture of our population, the other part is our virtual environment. Excuse me. There are really 4 parts to building this virtual environment. It's the virtual environment itself, then the content and services, the communications, and the automations. And I always say that building the virtual environment is kind of like building the house. So you know exactly the neighborhood that you want to live in. You just have to basically build the house. Then the content and services is where you become the interior decorator. You're, putting in all the things that you want to provide for whoever comes over to visit. Communications is making friends and inviting them over. And then automations is really about being a great host and making everybody feel warm and welcome when they come in. So again, some of you may already have a virtual environment in place, but we don't want to make any assumptions. So we're going to start at the very beginning. You know your population, you know exactly how they prefer to engage or the necessity that they need in order to engage. And so you want to be very intentional with how they can access you. You're building this virtual house. How many doors is this going to have? Are they going to be able to enter this via telephone? Or is this going to be via email? Are they going to have to download an app? Are you going to provide a mixture of different channels in order for them to access them? So this is really an answer that that's an answer that you'll have to, or a question that you have to answer after really finding out what works for your population. If the average age of your population is in their 70s, then that may not be the same as if you're working with college age, I was going to say kids, but I guess they're not really kids anymore, or college age adults. Then as you are sourcing your software or platform or app, whatever that may be, an important thing that we really wanted to point out here is, as we mentioned earlier, there's a lot of non-traditional players in this space, and we have more options and solutions than ever to provide these virtual digital environments. Please make sure that they are privacy and HIPAA compliant. That is something that kind of gets forgotten about sometimes just because we get wooed with all the bells and whistles, but it is really important that we continue to provide that standard of care, and that these bullet points, I mean, these are just 5 basic bullet points that you can go by to check if your current software or your future software is HIPAA compliant. And of course, you can always reach out to just the developer and ask them as you're doing your research. Excuse me. If you're a health coach, nurse, doctor, psychiatrist, life coach, or any of the other, there are also some extra resources for you to check out if you are looking for a new digital platform or a website or anything along those lines. If you currently already have one and it's been a year, 2 years, or 3 years since the last time you kind of scoured the market, as you can tell, this is a very, very fast evolving landscape. And I highly recommend just taking the time, doing some research, and just seeing what's out there. Some of the good platforms that are out there are not just affordable, but everything that we're about to talk about are things that new or just up-to-date platforms can offer for you, so you don't have to worry about, keeping up with the Joneses yourself. So as we talk about the content and the services, before we dive in, there is one more poll that we want to do. So whenever you're creating content and services, keep in mind again that you are engaging with a healthcare consumer. So there's a lot of research out there that talks about the attention span of healthcare consumers. And we want to know from you with this poll, how much time do you have to engage with your audience, with your healthcare consumers, before they often move on or their attention span gets them to do other things? And we are waiting for the poll. There we go. What is the attention span of your digital users? We have 3, 8, 13, and 18 seconds. Majority of everybody has gotten the last two polls right. Let's see who can go 3 for 3. But I know you guys are all experts. So I'm gonna give you a few more seconds. I almost wish we were in person. We could, I don't know, give away candy or something. I don't know. Well, this is a wellness webinar. So we'll give away apples or something. All right. So, and 8 seconds. We do have a lot of experts here. Present value, engage your audience in 8 seconds or less. So a lot of the content on the upcoming slide, on this slide and the next 2 slides, is going to be a lot of dense information. And I'm not going to touch base on every single item of it. We wanted to present you with all the information so you have a resource to come back to, but we are going to highlight some of the most important things. So for content, again, this is really you designing the space, knowing exactly what it is that your audience or your population needs from you. So what are you providing that is of value to them? This may be a coaching hub where they can track their progress or check in on their goals. This may be lab results or just accessibility to you to schedule certain appointments. Also trackers, we talked about real life or real-time data collection. Maybe you're providing resources and information and making sure that all of this information is front and center. Again, you've created the virtual space, you unlock the front doors, and when they come in, what is the first thing that you want to present to them? You only have 8 seconds to do so. Excuse me. Then moving forward with the communication part of it. Again, communication is you're making friends, you've built the place, you've decorated the place, and now you're inviting people over. So how do you communicate with your population? As Brittany mentioned earlier, majority of people prefers text messages. Text messages are highly, highly effective. So how is this something that you can incorporate in your communication strategy? Then, of course, there are many ways in order to engage with your population. We never recommend just having one single way. We want to make sure that we can really permeate their space and that we can draw them into our environment. Most importantly, you want to set expectations for communications. Most people these days do expect real-time communication, like Brittany mentioned, having some sort of response within 10 seconds, within 10 minutes. I am raising the bar here, guys. So having expectations that you set with people. Oftentimes, I know specifically when I'm coaching with people as well, I let them know, hey, I usually respond within a couple hours, but at most, it may be up to 24 hours. So they know if they send a message into me, usually, it doesn't take that long, but just so they know, their coach is not ignoring them or their healthcare provider or whoever that may be is still, engaging with them. Also, if you are new to this space and you're just creating your digital environment, using the channels that you've already established. This is very, very important. If you already use email and your population is used to communicating with you via email, it helps including other channels, but we do want to make sure that we're not all of a sudden alienating people that you have established a rapport with. All right. And then the third part of this was being a great host, aka automations. So automations really are the lifeline that alleviate all of our escalating workloads right now and serve our population or allow us to serve our populations in the way they expect us to. So instead of us maybe having to respond to a message manually within 10 minutes and really trying to accomplish that magic kind of window, automations can help you provide that level of service, because oftentimes it's not that they need a fully personalized response. Oftentimes that first initial response can be either some sort of AI troubleshooting and say, oh, is this a question regarding, installing a tracker or syncing a tracker, and providing that kind of level of service, or just simply letting them know, hey, your coach received your message and is currently, working with other people. So automations are really going to be the the glue, so to say, that allows you to accommodate this healthcare consumer and just meet their expectations. Also, for automations, there are certain processes that we're currently doing or have done in the past that really don't require human touch. So onboarding and introduction. Those are certain things that can be done at scale without having your time. Every single time there's a new person, a new patient, a new consumer, so to say, and just making sure that you are minimizing the time that you spent on admin type of tasks. And that includes assessments, that includes scheduling, that includes certain reminders. All of those things should really be automated. And like I said earlier, if you are working with some sort of digital solution, a good digital solutions will be able to automate every single one of these and allow you to automate them in a way that still create that personalized feel for your populations. So at this point, it's really about working smarter, not harder. I guess that's really what it comes down to. All right, so next we have some best practices. And as I said before, this is a lot of content, and I'm not going to touch on everything because I want to make sure that we have enough time for questions. But please, if you have any questions about this, put them in the Q&A section. So certain things for content with the best practices that we know that research says, our own internal research, and just our as well expertise and experience. Your population, when they come into your virtual space, they are looking for the things that bring them value. So having a clearly labeled navigation. I'm going to highlight this again and again. You only have 8 seconds to catch their attention before they either want to contact you or before they go to some other place. So making sure that it's front and center again, exactly what they need. And then having some sort of value proposition. So if you're providing content, showing them the value that you're bringing to them. So having the how-to and the 10 tips and the 15-minute healthy meals or so within the title. I know that when we used to go to doctor's offices or just any kind of health or wellness provider, there used to be pamphlets in the waiting room. And there was really nothing else for us to do except for sit there and consume this kind of collateral that was in front of us. But now, again, we are really competing for someone's attention who has a wealth of options as far as material they can consume at any point in time. I'm pretty sure that some of us are sitting here right now and there's other stuff happening that can probably be consumed or other messages that are popping up while you guys are watching this webinar. So it's really important to drive home the value that you are continuously providing for everybody who's taking the time to enter the space. Then there are some more best practices as far as communication. The biggest one that I want to touch on here is going to be aligning your communication with your population. So Brittany talked earlier about the stages of change. If you are a health coach, then you are hopefully fluent in the trans theoretical model. If you are if you're a health or wellness provider of any other kind, I highly recommend that you familiarize yourself with that, because if we align our communication strategy with where our population is within their change process, it can exponentially grow, impact on our population. So for example, if someone is in the pre-contemplative stage right here, that we kind of just shorten to PC, we know that they're not ready for change. So we don't want to make that assumption that if we just give them enough, if we just convince them, we can get them ready. No, at that point, we want to provide them with information. We still want to touch base with them, but we know that they're just currently not ready, especially for the habit or for the solution that we may have for them. Then if somebody's in the contemplative state, we know that they may be closer to change, and that's why we increase the frequency. So instead of sending messages monthly, we maybe send messages weekly, and we continue to provide that information. Excuse me, and we use the motivational interviewing skills. We make sure that our communication, if possible, you ask open-ended questions rather than yes or no, or rather than just providing something without receiving any kind of feedback. And then the same goes for the preparation stage and for the active stage. We know that people in these stages need the most support in order to have successful results. And this is where we want to make sure that we're providing that. And again, with automations, you can create those touch points. You can schedule text messages with relevant content. In most softwares these days, you can create care paths specific for your population. So if somebody is in the preparation or active action stage for exercise, you can schedule that where they get where there's a cadence to which they receive this certain kind of content. This is going to be a huge differentiator in the results that your population will be able to see. And like I said, this is something that any kind of digital solution should be able to help you with in facilitating this. All right, and then next, again, automations. Appointment reminders is something that has become, again, we're moving towards the need to have rather than nice to have. The people are just busy, and oftentimes we're distracted and we forget about things. So 67% of consumers find that reminding them prior to an appointment find it very helpful. And then again, there's a lot of automations that should be just standard business practices for you: data collection, feedback collection, reminders for missed appointments. All of this should become standard to really allow you to have an impact on your population and not focus on the administrative burden that this healthcare consumerism has basically put on us. So again, if you want to read through this in more detail, then please refer back to this. Most importantly, okay, so I'm going to skip through this just a little bit because I know I want to get to some other stuff before we run out of time. But here's some more best practices that we have for specifically onboarding your population. There are really 4 questions that you ask yourself in order to provide the necessary onboarding experience that will allow your people to come into this awesome virtual environment that you've built and to introduce them to the value that you have created for them and the content and the services that they can find in this virtual environment. Next, we have some best practices for data collection. And here we have specifically for assessment and surveys. And these are simple guidelines that you can follow in order to create and in order to maximize the response rates that you want to get from your participants and from your population. Again, these are just all best practices that we have collected internally from research, from our own data, and that we feel are just some of the most important practices that will allow you to maximize your impact and your relationships with your population. So lastly, not least, and certainly not the least important, is how do you know that you're successful? So now we've told you all of these things. You are investing time in getting to know your population. You're investing time in creating this digital environment, filling it with the content and services, making sure that you're communicating with your population, and that you're automating as many services or as many tasks as possible. We want to make sure that we don't lose sight of why we're doing this in the first place. How will you know that all of this effort you invest is actually successful? First and foremost, we know reporting. Again, any solution that you have out there should be able to provide you with reporting. So if you are tracking data and people are providing real-time data, making sure that you have the reports that show, after working with this certain population for X amount of time, this is how their data changed. You want to make sure that you have some sort of feedback loop that allows you to continue to improve your services and allows you to continue to improve the impact that you have. Same with measuring the outcomes. And also for communication, if you are providing virtual services or telehealth services, appointment completion rates. So how many of your participants are showing up for their appointments after they're actually receiving that 15-minute notification or the 15-minute reminder saying, hey, you have an appointment coming up in 15 minutes. And then most importantly for you yourself is, of course, understanding that you have more time to focus on your population because you have scalable and frictionless workflows that decrease the daily tasks in order for you to maintain your practice or your services. So again, we are right at 10 till, but this is really important before you even kind of get started, just understanding what success looks like for you, how you want to continue to measure success, and the things that you want to look at in order to improve your virtual environment. So lastly, before we get to the Q&A, I want to leave you all with a quote from Sir Richard Branson that the key is to set realistic customer expectation and then not just meet them, but then to exceed them, preferably in unexpected and helpful ways. And I think with the technology that is out there, coupled with all of our experience and expertise, we really have an opportunity to impact our population, to continue to improve the lives and the well-being of all of the people that we love to serve. All right. So, Suzanne, if we should have enough time for questions, correct?
Yes, we do. And I'm actually going to add right now in the chat. Again, if you're on your cell phone, you probably won't be able to receive it. So you can email me. I'll put that in there as well if you need another access point. But I just put another copy of these slides in the chat. And I'm going to post a PDF to the chat as well right now that Avedon actually created for you all. And so I'll add that now, and then I'll do the questions in order of submission, if that works. So the first question is, how do you handle motivational interviewing through digital delivery?
Can I take this one, Zoe?
Absolutely.
This is one of my favorites. So one of my biggest passions is motivational interviewing techniques and looking at ways that we can automate, ways to interact with people with motivational interviewing techniques where it's not just responses back and forth. And so I always like to keep in my mind ORs. I want to make sure when I'm messaging, I'm using open-ended questions. I'm utilizing affirmations, not to be confused with cheerleading. I'm not saying great job. It's more of, wow, you're really dedicated to your goals. We're using reflection. So before asking another question in a digital manner, reflecting back first what the person said. So for example, if you're asking them on a scale of 1 to 10, how confident are you? Using branching logic in the digital messaging so that if they answer 7 or higher, you can say, wow, you're really ready to take this on. And then also S for summary. So before ending the digital conversation or interaction, summarizing what had happened, or asking the person what was their biggest takeaway. So that's just 4 examples of how I like to include motivational interviewing techniques in digital interactions.
Thank you for that. We have a few more questions, and I want to encourage everyone who's still here with us, depending on what your time frame looks like, if you have other questions that you have specifically for Zoe or Brittany, please feel free to reach out to them. That's why they're here. That's why their contact information is on the page. As you can see, they've done a lot of great work with Avedon. And with that, I'll go to the next question. And I think actually you kind of hit on this a little bit, Brittany, but maybe if there's anything additional to add, I'll make sure that I, bring this question up anyway. But how do you tailor your communication at each stage? How do you tag or identify the individuals in each stage?
I think. Oh, go ahead, Zoe. Sorry, take it away.
I was actually going to say this one and the other message, the other question are fairly similar. Brittany, I'm going to let you add your 2 cents because I think you're going to say something different than I will. First and foremost, again, this is really about leveraging technology. We can't thrive in digital health without leveraging technology. And assessments are going to be the easiest way to identify your population. There are tons and tons of solutions out there that allow you, as part of the onboarding process or just maintenance and check-in process, to quickly send out a link, let your population just answer 1, 2, or 3 questions that help you identify the stage of change that they're in. Again, this can be with the readiness ruler. This can be asking them certain questions about how soon they are looking forward to actually changing their behavior. There are many different ways of assessing that. And then from there, you can either automate the responses, you can either automate the communication. So again, it's about mastering the tools that we have at hand in order to scale our impact. But there's a lot of tools out there that allow you to create different flows for different care paths. So if a person says, I am ready to go now, I am ready to make that change, you can funnel them into a care path that allows them to have 2 to 3 touch points every week outside of the manual communication that you're doing with them. And that can be relevant to any kind of area of interest. So let's say, for example, they want to start drinking more water and they are ready to do this right now. They have to do this right now. They are highly dehydrated. Then these touch points don't necessarily have to be motivational interviewing at every point. These touch points can simply be, hey, here are 5 tips to help you increase your daily water intake. And the next one can be a follow-up, hey, which one of these ideas or which one of these tips were you able to apply? And if not, why not? So to answer the first part of the question is let them assess themselves, decrease that administrative burden on yourself, automate that assessment part, and then B, if you can, funnel them into a care path where you already create those touch points moving forward.
Absolutely. And I think to reiterate that, it's us wrapping our minds around, say you have a program, you shouldn't have just one program, like a healthy eating program. There really should be 5 separate ones that feed into that. There should be one for those in pre-contemplative, ones for those in contemplative, et cetera, et cetera. So it's understanding that we have to have variations that are funneling into the same purpose, the same broad program.
Absolutely. And some of this sounds a little overwhelming, especially if you're not familiar with some of the solutions that are out there right now. But again, there are some solutions that make it really, really easy to do that. And it's well worth the investment of just doing a little bit of research and making sure that you just automate these processes for yourself. All right.
Okay, I think we have a few more questions, some in the chat, some in the Q&A section. We'll see what we get to. Again, encourage you to reach out directly to them if we don't quite get there. The other question I want to make sure we hit on, because I know for some people, depending on what type of organization that they're in, this could be a barrier for them, depending on what access or what IT is, providing possibilities for. But what suggestions do you have when the company is pushing for less emails or direct communication and pushing to have everything more of, communicating through a hub or a SharePoint type of site?
That's interesting, because what they may find is that it may or may not be a successful program in that case, because you're forcing people to take another step. You're forcing people to come to you, but we need to meet people where they are in their environment. Hello, this is my environment. So that's tricky. I understand corporate wise, right? You don't want to be spamming people's emails, right? Only 20% of people open up their emails. So I think that might be a bigger conversation with corporate of what are their goals, really?
Yeah, there may be a specific use case where that is a great strategy. So it really comes down, like Brittany said, it comes down to really identifying your population and how you measure your success. And if you know that, and if you know what makes you successful, then I would go with aligning the strategy.
Thank you. Okay, so we only have 1 minute left, but I know we have 3 really good questions. So those questions that are still looming, I encourage you to reach directly out to Zoe and Brittany with those questions, or just take a look more at what Avedon has to offer if that's of interest to you. For the sake of time, we will end there today. I appreciate everyone for coming, and I really appreciate Brittany and Zoe being with us today and sharing their wonderful expertise and experience, and giving us some more information about the helpful aspects of digital technology and how we can leverage that better. So thank you, everyone. I hope you all have a wonderful day.
Thank
Thank
you.
you.